students are here, we can start. Amit will join and he will speak when he joins.
Okay, cool. So just give me 1 minute. I'm setting up the YouTube live, and then I think
No
we are
problem.
good to start.
Amit is also here now. Hey, Amit.
Amit, good morning.
Good morning.
Must be early morning for you, 7 o'clock Central Time, huh?
Yes, it's 7. Yeah, Amit ji, good morning. Yeah.
Good morning.
Huntsville Central Time? I thought Huntsville is
Yeah,
Eastern Time.
No,
No,
Central.
Central.
So, what time are you starting?
So I'll start the meeting, sir, then. Hi, so good evening, everyone, and a good morning to ones joining from
Why my
US.
video is not coming?
It is.
My video is coming?
The one with Dr. Abhishek, the blue screen is coming on.
No, my video is not. Okay.
Like, yeah, we can
No,
see you.
you can see? Okay, that's
Yeah.
good. Okay.
Okay, so a very good evening to ones joining from India and a good morning to ones from joining from US. I think this is a very unique opportunity that I have been honored to deliver in front of you. So James, in collaboration with API and in collaboration with Datri, is launching a stem cell drive in India. And with the grace of all the honorable API leadership, we have been able to launch this drive at the Global Health Summit 2026 in the month of January this year, and which has we got a good response, 200 plus registered. We got registrations for the stem cell, and now we are launching the stem cell drive pan India. So before we start, I'll just go and give you a brief about what is James and why James is taking up this initiative, and why James is the workforce and how we can do it. So these are my team members. And so James is an organization that was founded in 2020. And we have been recognized by WHO Civil Society Commission. We have been registered on the AMR stakeholder platform. And we are also the only medical student organization that is in partnering with the Partnership of Maternal, Newborn and Child Care Initiative. And we have a strategic partnership with API. And that's why we are working with a lot of projects. If you see that we do in collaboration with API, and we're very thankful to the API leadership. And our work has also been appreciated by the High Commission of Mauritius and Nepal. So currently we have 20 plus state chapters in India, and we have more than 5 plus international chapters and more than 12,000 members and 5 international chapters. And we have already completed more than 500 projects, 250 plus college boards, and conducted 60 plus workshops across India. So one of the projects that we did with API was Project Suraksha. And why I'm giving you an example that why James is capable of doing this, the stem cell drive in India. So Project Suraksha was launched in last year in Lucknow, and we have been able to create an impact of more than 12,000 plus school-going girls. We have been able to sensitize them about HPV vaccination and conducted more than 50 plus camps. And the expense of that, when we talk about doing such an impact at such a bigger level, so it's always considered that such projects are costly, and it's difficult to implement, and a lot of funding is required. So if you guys can just open up your chat box and give how much do you expect, that what was the cost for this campaign that we did in India? So just take a wild guess what would be, or if any of the RP leadership wants to guess around what was the cost for doing this campaign in India. Anyone?
So for the entire India, just the
Yeah.
campaign and conducting camps and everything?
Yes.
Okay.
Yeah, knowing you, Abhishek, it would be very inexpensive, so.
It was around less than $350, so pan
Oh,
India.
Oh,
And
man.
yeah, and
That is
that's the
that is
power
very
of
yeah. That's the power of
that's the
their
power of medical students. Yeah. So, so what next? So we are launching this RP Stem Cell Ambassador Program, and this is mainly for the medical students. And what is the the SOP that we're going to follow is we're going to train the students. And why I call it a ready to eat format, because we'll be giving them the educational material, presentations, and marketing material that they can utilize and train the colleagues, and also get accustomed what is the stem cell drive about and why it is necessary. Then we'll also be moving at the second phase, that is advocacy through social media campaigns, through college, campaigns, ground level campaigns, and panel discussions. And then we'll go local. That is where we involve the community, and that's where we do the drives. And then, of course, a lot of students are interested into doing research. So we are planning to do the gap studies in India, so that when they do these drives, they also collect a certain amount of data, what is the impact that is happening and where is the gap, so that later on we can convert it into policy recommendations and recommend the government that why this sort of thing is important, and why such advocacy is important among the youth as well as the masses, so that we can fill in the gap. So that was a a brief introduction. Now those of you who are interested, you can always reach out to us on my personal email address as well as the James email ID, and we'll also be sharing some Google Forms during this meeting where you can just sign up for the ambassador program and conduct these drives with the help of the Datri leadership as well as the RP support. And now I'll hand over the stage to Dr. Sashi so that he can put forward about why the stem cell drive was started in India, why we need it, and what's the vision of API. So Shashi sir, the stage is yours.
Good morning, all. My name is Sashi Kupala. I am a neonatologist based in America, and I'm also a proud member of API, American Association of Physicians of Indian Origin. We are a association of 12,000 physicians strong, and we are very active in every which way in the states. And Dr. Satish Kattula, who
Actually,
was
15,000, Shakti. 15,000.
15,000. We've grown recently. So Dr. Satish Kattula, who will speak in a minute, he was the immediate past president of API, and he was being an oncologist. He saw this problem that Indians are losing lives primarily because of a preventable problem, which is stem cells. So we don't have a lot of Indian stem cell donors registered anywhere in the world. Actually, you'll see the numbers in presentation by Gayatri Shanai from Datri in a minute. Those are heartbreaking numbers. So realizing that this problem, Dr. Kattula has started this stem cell drive project last year in the States, and we've done several drives across America. And now, under the leadership of the current president, Dr. Amit Chakrabarti, we are bringing it to India. So primarily, this is a project we all need. You need it, I need it, because we don't know who is going to be hit by cancer tomorrow. So before the problem knocks on the door, we want to be proactive and find a solution for that. So that's the reason for starting these drives. I cannot say enough good words about Games, James. These guys have been fantastic. You guys have been amazing, really. The leadership you guys show. The teamwork, the proactiveness is really amazing. It's really great to partner with you in this great cause. And I cannot again say enough good words about Gayatri Shenoy and Datri. They are really good partners to have. She made a good presentation, stating the problem and the next steps to go from here. At the end of this presentation, think about it. We really want you to be part of this project. We cannot do it ourselves, really. We need all of you guys' involvement. If you guys can take this project to your respective med schools and talk to the administration and start doing drives there, that would be amazing. We will help you in every which way. What I need from you is a little bit of like intention to do a drive. We will work on the logistics. Gayatri, Abhishek, and I will work on the logistics. We'll help you in every which way. It's kind of like a partnership. At the end of all of this, in a concrete way. You also can be benefited if you want kind of like a volunteer certificate from the states. We can give it to you. If you want any letter of recommendation from us, we can give it to you for your USMLE applications or something. So it's kind of like a both useful both in a personal level and also at the community level. So I'm not going to take much more time. Dr. Satish Katala, the immediate past president of RP, who started this project, if you could speak for a couple of minutes, that would be great. Thank you.
Thank you, Shashi, and everybody for having me. And this is a great project which we initiated last year, 24-25. And when I thought about it as an oncologist, I mean, I've seen a lot of patients, especially of Indian origin, South Asian origin, losing lives. So I thought this is a great project to start so we can increase the stem cell pool from Indians. And then Shashi and me talked, and Shashi just, took this project and ran with it. And he has done such an incredible job. And he recruited so many people here to do the camps and everything. Now, with Amit Chakravarti's presidency, we are actually expanding that to India. So I'm so glad Amit is continuing this project and expanding that to India. And Games, we partnered with Games, for many years. And thanks to Dr. Lokesh Adara, who introduced us to Games, we have been having this great relationship for the last 5 years. And we have done many projects, including cervical cancer awareness project, HPV vaccinations, and things like that. And also, they have been instrumental in helping us with global health summits in India. So we are very glad to partner with Games, and we are looking forward to a successful project even this time. So thank you all for your help. This is the need of the hour because there are so many who really need, the stem cell match donor. So I think more the merrier. So the more, and I'm so impressed that you want to do this Pan India campaign for less than $350. I was way off when I put my number in the chat box, but I'm so glad that it is so inexpensive and you're doing a great job. Thank you so much.
Dr. Amit Chakravarti, who is the current president of RP and who actually brought this project to India. If you could speak for a minute, Gayatri, probably he needs to be unmuted.
Hey,
I
hi
don't
guys.
think I can. Okay.
Hi guys. I don't know whether you guys can see me. I can only see my black screen. I don't know what's going on. But good morning, guys. Good evening to all of you. I'm the president of API, and as Sashi has told you, Satish, my good friend, started this beautiful project in the USA, and we were getting, maybe Sashi, he said, took it and ran and made this very, very important project. I had a personal friend of mine who actually could not find a match and almost was dying. He's a RP physician. He is actually from Wisconsin, and he luckily found a match with his brother in India. So I know how important this drive is. So. Sashi had taken this to another level and had conducted drives in temples and schools, etc. In USA. But obviously in USA we were getting a few, maybe 10, 20 each time he used to conduct a drive. And so when we had this global summit in Orissa this year, I introduced them to our partners and the Global Summit, which is our partner is the Games people. They have been our partners in Global Summit for several years, but this year Abhishek is has taken the lead. He's the president. And once they got together, I didn't have to do anything. I just stepped back. Man, they took it to such a great level. And we had great support from the host college. The host college was KIMS, Kalinga Institute of Medical Sciences. And their principal and their superintendent, they promoted this all throughout the students. They gave the speech, they gave also on stage. They really, really are with us on this one. And they conducted the stem cell drive during the global summit. And we got, I don't know how many did we get, Sashi? How many signed up for the thing in global summit?
238.
238 in one swipe. Just imagine, and that this is just the start. So it is the partnership of Games in this one is going to take it to great levels. And Sashi, Abhishek, you guys will have your names written in history. Lot of blessings you'll get for doing this great project. Satish, thank you for starting it, and I'm so glad that I could take it forward. Thank you so much for all your participation.
Thank you, Dr. Chakravarti. So Abhishek, probably we can start the program now.
So I'll hand over the stage to Gayatri ma'am.
Yeah, hi everyone. Wait, let me just share my screen. Give me 1 second and let me know when you can see my screen, okay? Can you see my screen now?
Yeah, it's visible.
It's good. It's on full screen now.
Yeah.
No, we can see. Yeah, it's full screen now.
Okay, so I can get started. So good evening, everyone, and thank you for being here. My name is Gayatri Shenoy. I head patient relations for Datri. I have been with Datri for the past 13 years. And before I go into, a little more about Datri and what we're doing here, I want to share, the whole reason I'm with Datri is because, again, since we've been talking about the need for blood stem cell donors, the whole reason I'm with Datri is because a very close friend of mine lost her 10-year-old son to leukemia way back in 2004 for want of a match. I was living in the US then, I was living in California. This little child who had been diagnosed with leukemia, healthy, happy, doing well, one fine day, started feeling a little bit of tiredness, weakness. It was around October. The family had moved to Seattle. The weather was bad. The doctor kept thinking it was the seasonal flu. The day before Christmas, this child collapsed. He had black patches all over, the bruises, was rushed to Fred Hutchison, where he was diagnosed with leukemia. And, one of the only treatment option for him after chemo was bone marrow transplant. So we were very cocky thinking, we were living in the country that had the largest registry in the world. How difficult would it be to find a match for this child? And imagine our shock when we realized that not only was that he did not have a match. His match would probably be another Indian and probably from the same ethnicity that he belonged to. And at 2004, India did not have a registry. So we spent a chunk of that year 2004 doing drives with NMDP outside Costco, outside Sunnyvale Hindu Temple, or different places, trying to find this child a match. And Jan of 2005, he succumbed to the cancer, right? So it's not something, so this Datri obviously doesn't bring that child back, but if it can prevent another family from going through what my friend's family went through or even goes through today, because I don't think anybody really gets over the loss of a child, I think it still feels like that's a job well done. So that was just my personal story of why, it's why this cause is so important to me, and why, it is important that we find a match for every person looking for one. So again, let me just move you through this. So today's presentation is about blood stem cell donation. It's also about how the Indian diaspora can come together for patients who are waiting for that life-saving match. It's a collaborative effort by Datri, API, and Gaims, as the people before me have already mentioned. A little bit about Datri. We are an NGO founded in 2009. It's India's largest registry for voluntary blood stem cell donors. Over 6.25 lakh potential donors currently registered. We facilitated more than 1,700 life-saving donations and we work with hospitals across the globe. But in spite of this, the need is still very large, and we have not even hit the tip of the iceberg right now. About API, I think Dr. Shashi has already walked us through. Really grateful for this collaboration with API, as well as, thank you, Dr. Satish, Dr. Amit, Dr. Shashi, who are here on this call. Really appreciate this collaboration because, as you understand, we still have miles to go. Thank you, Gaims. Again, Dr. Abhishek has already talked about Gaims. So both of you have made my presentation a little easier because, and again, we need the support of all the medical students who are on this call today to help us spread the word. So now let us look at the scale of the Indian diaspora, right? There are more than 3.5 crore people of Indian origin living outside India. And in the United States alone, there are over 5 million. So this is a massive, it's a connected and influential community. So even a small percentage of this diaspora registers across the world, we could literally transform the survival rate of thousands of patients. So when the whole idea of showing you this map is Indians, no matter where they are in the world, chances are very high the match will come from India, right? So they could be staying in the US, they could be staying in Canada, they could be staying in any of these places, but chances are high that because their match comes from India, it is imperative that we increase the size of the registry in India. So HLA typing is stem cell matching is based on something called HLA typing. Right now, across the world, there are 42 million donors, which is accounted for by 130 registries. But here's the challenge, right? Patients are far more likely to find a match within their own ethnic group. So for Indian patients, people of Indian origin, the best chance of survival really is donors who share a similar genetic background, that is people like us on this call. So, what is the reality for a country like India? There are about 1.5 lakh thalassemia patients in the country. Every year, about 15,000 babies are born with thalassemia. 1.38 lakh people with blood disorders in the year 2025. But more than this, there's another number that I'll show you in the next page that is really stark and that really should make us sit up a little bit because of all the requests that we get, of all the actual need there is, less than 5% of the need is actually met. So just take a minute. I'm going to pause at the screen because you'll see what these numbers look like, right? The number of requests that come to us and how many we are actually able to satisfy. Across the years, you can see it is less than, the best we've done is about 5%. So you can see there are so many patients who could have been cured, but don't only the odds are stacked against them only because of their ethnicity. Say for example, a Caucasian patient is able to find several matches, whereas an Indian patient, just because of his ethnicity, the odds are stacked against him. He's not able to find a match. So why is it important to have a registry in India? India is definitely one of the most genetically diverse populations in the world. Because of this diversity, it's also difficult to find matches unless we build a large enough donor database for the Indian community. So as you can see, this is not really just a medical problem, right? It's also a community responsibility. So I think the bottom line is Indians need Indians to survive. And this is where we play a large role. And as you can see, we all the registries across the world feed into the World Marrow Donor Association. So whether there is a donor from Datri sitting here in India or there is a person sitting in Germany, we are all able to help any patient across the globe through the WMD. It's truly, the world is one family. It's Vasudhaiva Kutumbakam. It is one family. So this is why my this is my roundabout way of saying that we need to do this not just for us, for fellow Indians living in India, but it is for fellow Indians living anywhere across the world. So what are these stem cells? These are uh, 1 minute. These are typed by, they cannot be manufactured in the lab. They cannot be, made to order. They have to come from another human being. And the matching is very specific. It's based on HLA typing, which is influenced by ethnicity. You're all doctors, what the various indications are. It's used for treatment of leukemia, lymphoma, thalassemia, aplastic anemia, several other blood disorders. And the important thing is for most of these patients, it's not just a treatment, it's actually the only cure. So how does one register with Datri? As you can see, the first one you already done, attend an awareness session. That's where you all are. You fill up a short form. It's actually a couple of forms. One is your height, weight, age, and the other is a consent form that tells us that you are above 18 and a consenting adult. You sign up, you give us a buccal swab, and that's it. You're onboarded into the registry. As you can see, this is, the very straightforward, simple process of registering. And here's the donation process. If you're ever found to be a match, there are two ways essentially to donate. One is through your peripheral blood stem cell and other is through your bone marrow. Peripheral blood stem cell donation is very similar to platelet donation. It's non-surgical. It's the most common way to donate. Bone marrow donation done under GA, it's safe and it has a slightly short, it has a recovery period. So most of the donors, like I had mentioned in one of my previous slides, we've completed over 1,700 donations, and most of the donors say that the experience is far easier than what they expected, and definitely that it was deeply meaningful. These are some of the corporates that we have worked with in the past, and we continue to do it on an ongoing basis. This is where we go register people so that they can be added to our registry. These are some of our donors, our past heroes who have gifted a life. Honestly, they're just ordinary people, right? They are your everyday college student, they are your corporate workers. But the only difference is these are the people who chose to step forward. And because of the kindness of a stranger, because of the kindness of all these people, there was possibly a child who went back to school. There was possibly a parent who returned to his family. The trajectory of a family's life changed because of the kindness of a stranger. These are very similar to how in the US the process of donation is anonymous to both parties, the donor and the recipient. And 1 year later, if both parties consent, Datri facilitates a meeting between the donor and the recipient. So you can see some of these are past donor recipient meets, and it's basically they're two strangers, right? They're often in different parts of the world. They're connected by a genetic makeup, and because of which the patient gets a second chance of life. Honestly, in the past 13 years, I can, hand to heart say some of the nicest people I've met are through this work that I've been doing. And this act of donation, it has to be one of the most powerful acts of humanity. So I've come to the end of, what the Datri, I'm going to open it up for more questions, of course, but I'd like to say, this back to our tagline for Datri, which is you have the power, act now, gift a life. If you're eligible, please do consider registering today. Help us spread the word. We we are in this together, so let's work together on this. And I'm happy to take any questions from here. And like Dr. Abhishek said, the end goal of this is to create an army of ambassadors who will take it back to your respective colleges and help us grow the registry one person at a time. Because end of the day, remember, it is one match. The patient needs one match, and we never know where that match could come from. So that was my time. If there's questions, I'm happy to take it, please.
So, Gayatriji, that's very nicely explained. And I know about Datri since 2015, in fact, So I talked to some people at that time, somebody needed stem cell donation back in India at that time, a person with leukemia. And, you guys do a very, very good job. And my question to you is, do we collect any umbilical cord blood cells?
No, that we are purely a blood stem cell registry, and we
Oh,
don't do any collection till there's actually a need. So we don't have the capacity to store umbilical cord blood. So it's only a registry which in real time the donation happens if there is a match.
gotcha. Okay. So, do you use any previous donors' testimonies that it is an easy process, it can be
Yes,
done?
yes, yes.
So, testimonies and videos also sometimes, right?
We do. It is there on our website. It's there on our social media. We've had testimonials from both patients and donors, from
Okay.
doctors who have worked with us. So yeah,
What about celebrities? Do you have any celebrities
yes, yes, we
advocating?
do. We do. Not that they've used our services directly, but people who have endorsed us along the way because maybe a friend or a family member needed a match at that time.
Okay, great. Thank you.
Did we speak then in 2015 when you were looking for a match for somebody, Dr. Satish?
Yeah, I think I spoke to somebody from your organization. I don't remember. It's been more than 10 years, but yeah.
And I
So
hope
somebody
you're
suggested that I talk to you. So
okay.
we could not find a match, unfortunately, at that time. Yeah.
Ouch. So is your friend okay? The one that was looking for one?
No.
Okay.
Family friend, so passed away.
Sorry. Yeah.
And in fact, as we speak, I just spoke to one of my classmates' son who lives in Minneapolis here. 37-year-old young gentleman. So he got diagnosed with AML recently with a very complex karyotype, meaning multiple cytogenetic abnormalities, which is poor prognosis. And he responded to chemo, but again, this is not going to last long. At some point, he will need. And he called me yesterday, last night. In fact, today is his birthday, and he was asking if we have anything available because there is no match for him here. So we probably will refer
Yeah.
him to you.
Please do. Please do. I think Dr. Shashi has my number. Please do. I'm happy to help your friend and, guide him on how we can at least run a search here and go back to wherever his roots and ethnic roots in India are and get the extended family tested.
Okay, great. Thank you so much.
Ma'am, we have a question in the chat box, Dr. Dara.
Yeah,
He's asking about the ratio of donors needed in USA versus in India.
I actually don't have the US numbers, but I know that, for a fact that Caucasians do find it a lot easier. See, it doesn't matter if you're an Indian living in the US, your odds are pretty much the same because you're looking into the same global pool. But Caucasians definitely do find it a lot easier to find a match. Uh, the Datri numbers you have seen.
So I have answers for that question.
Mm-hmm.
In America, out of the total population of 35 crores, there are close to 1 crore people who are registered donors. So 1 crore out of 35. And in India, out of the how many crores we are now? 140. Out of the 140 crores, we have 10 lakh donors. So that's why we need to register more donors so that the patients can have better choice or better chance
Yeah.
of getting a match.
Ma'am, we
Is
have
this
another
limited to
question.
is this limited to USA Indians or can be among Indians in India? Yeah, so this, what I have been talking about is actually Indians in India. What Dr. Shashi was talking about and Dr. Satish was talking about is, and the initial part of the project was to get Indians in the US registered, but now they've extended their support all the way to India. So Datri does do, I mean, our role is limited to getting Indians in India registered into the database. And yes, these projects help Indians staying in India as well as Indians staying anywhere. So how Datri works is we recruit donors from India, but we service people across the world. If that answers the question.
By the time we are getting more questions, I just want to highlight that I've already shared the Google Form link for the ambassador program. So you can just fill it up and the same form will be used for the certificate of attendance and you'll be getting it by email. And Gayatri ma'am, I just had few queries. I think that would also help out the students who are planning to do this drive at the respective colleges. So how Datri is going to help us in logistics because these students are they have in the first year or maybe they're in the final year. But when it comes to having these drives at college level, so how Datri can be there and what kind of support Datri will be providing? So if you can
So
just give an overview.
definitely. So so if you decide to do a drive, if there's an ambassador from the college who says, yes, I'm willing to help, like you mentioned in your presentation, the first step would be to create a little bit of awareness through social media, through, whatever other channels there are in the college. And then we will, send somebody with so okay, let me rephrase. If it is in a city where we already have Datri representatives, say for example, somebody from Bangalore says they're interested and we have people in Bangalore, our Datri representative will go there on the day that we decide, put up a stall, collect the samples, and come back pretty much like we did at the Odisha drive. But if it is, say, in a city where Datri does not have representation, we will, walk the student who wants to support us. We will train the student. We will send the kits and the material, the marketing material, the banners, the table. We will send all of it so that they can independently run the drive.
Is there any special technicalities that are required for the students to do these drives or collecting swabs and all?
Not at all. And especially given that these are med students, definitely not. It's just a buccal swab, very similar to, the RT-PCR swab that we did during COVID times, except instead of sticking it up the nose, you stick it into your mouth, scrape the corner of your cheek, and that's it. It's the trickier part is actually explaining to people the what happens if they are found to be a match, because the objective isn't just to add people to the registry, it is also to add people who will donate when the time comes, because the worst thing to happen is for a patient to find a match and then the donor backs out because he or she is not convinced about the donation, right? So we have to be sure that the registration part is less tricky, it's more the awareness part.
We have another question from Aratya in the chat box.
If a person living in supposed to connect them to Datri, what's the pathway? So no matter where they are, they will still have to come to a hospital to get a bone marrow transplant, if that is the path ahead for them. So you just have to, share my number, connect them. I will, or they can send their HLA report to us directly. We can let them know if there is a match, and then we will coordinate with the hospital, wherever the hospital may be, if it's onboarded with Datri, and we will make the donation happen. Dr. Palak. Yeah, so Nepal, we had done drives in the past for a patient, but right now we aren't doing drives outside the country, mainly because tomorrow, if somebody is found to be a match from the drives that we do, getting them to do, come to India to make a donation becomes very challenging for us. So we are limiting our registration to, the states in India.
So just to add to that comment, small comment, just for an overall view, every country has got their own stem cell bank. Datri is in India, and in America we have NMDP and also DKMS. These are like several different stem cell banks. So many countries have their own. In UK, they call it Anthony Nolan. In Canada, the Canadian Blood Bank, the government Canadian Blood Bank takes care of the stem cell donation. So some countries or several countries have their own blood banks. Countries in Africa are kind of like underdeveloped countries, may not have their own stem cell banks. But we're trying to expand this drive to Africa and other countries in Asia also. So if anybody has any contacts in other countries, please let me know, get in touch with me. That would be very helpful in our effort to expand these drives to other countries also. We are exploring the opportunities in Kenya, but Kenya, unfortunately, they don't have a stem cell bank. There is one, but I don't know how effective that is. But in general, just for knowledge sake, every country has got their own stem cell bank.
I think you can unmute it, Dr. Amit, because I don't know. Dr. Kashyap, can you unmute?
Yeah. So
Yeah.
now I unmuted. Thank you so much for letting me in. I was just listening to it, and very glad to be introduced to what Datri is doing for this. This is first time I'm hearing. I know that they have a presence in India and doing a lot for a long time. What I was trying to say is that we launched this in Global Summit. There's a lot of interest back in KIMS and the other hospitals in other medical colleges in Orissa. Can we not take this drive right now? I want Abhishek to call me offline, and I will try to see if we can use that momentum which we created in the Global Summit and continue that. I'm guaranteeing you in KIMS itself another 250 people in that KIMS area, and there are a lot of other medical colleges in that area. My classmates, my juniors are actually principals and deans of the other colleges in Bhubaneswar. So we can use this momentum which we created and also the support which we have got from the principal of KIMS and all to propagate this message across. And you know how powerful Achut Samant is. If we have him speak, it'll be like God speaking. Okay, so please follow up with me. We will try to get you use this momentum to get this from not only colleges in Bhubaneswar, but also the other colleges like in MKCG. We went and we launched the HPV drive. They are very, very open to API's project. So in Berhampur. So please call me and we can coordinate something and use this momentum to get that going.
Surely, sir. Surely, definitely we'll do that. Gayatri ma'am, I have just another question for you.
Sure.
How different, stem cell donation is when we compare it to blood donation? Because when when these students are reaching out to the masses, so that's the very common question they are asked about, and and they at times think that whenever they sign up for the stem cell, they have to donate immediately. So if you can just give a clarity on that.
Yeah, so blood donation you're doing then. You're doing when you walk into a blood donation camp, you just go donate your blood, and then your body makes up for the lost blood over the next few days, right? In a blood stem cell donation, a blood stem cell camp, you're not donating anything. You're only registering. You're giving a cheek sample, and you're pledging to be a donor for a later time. Now, if and when you're found to be a match in the future, even at that time, you're doing the 4 days of GCSF before the actual donation happens. The GCSF is increasing your stem cell count a little bit. So what you're donating actually is the delta. It's the difference. It's the extra stem cells your body made in the last few days. So most of our donors, once they donate, there's no real like a recovery period. Many of our donors just go back to college the same, like they donate in the morning they're already attending the afternoon sessions in college, or they're going back to work. Or we've had donors who have finished donating at Narayana, Bangalore, and taken a flight in the evening, even outside the country. So none of our donors really have had to put their life on hold because of a donation, a peripheral blood stem cell donation.
Thank you, ma'am. So I think we have answered most of the queries. And guys, in case you have any other queries, you can always reach us out. And I have already shared the form. I'll share it again, so that fill up the form and you will be getting your certificates, as well as we'll be contacting you for the drives as well.
So just one more comment, Abhishek, before we go. Just to add on to Gayatri's comment there, one of the most common misconceptions what we're seeing in our experience, even among the doctors, not medical students, not common people, just like practicing doctors also, is the misconception is that stem cells need to be taken from bone marrow. That used to be the case, but not anymore. More than 90% of the times, the stem cells can be taken from just peripheral blood, just like blood donation, really. Yeah. So we're not going to the bone marrow. We're going to the bone marrow very, very rarely, less than 10% of the time. So that's one of the misconceptions we see. And actually, donating stem cells is much easier than blood donation. Because in blood donation, they take the whole blood and that's it. In stem cell donation, they take the blood and then they filter, they centrifuge the blood and just take the stem cells out and put everything else back into the donor. So basically, the donor is not really losing anything except the stem cells. Yeah. The donor is not losing protein, the red cells, white cells, or anything really. So it's easy peasy, similar to blood donation, but better than blood donation in a similar way, in so many ways.
So, one thing, Sashi, we cannot say it's better than blood donation because they need a bigger line to collect stem cells. Uh, Being an
Right.
oncologist, I'm getting too technical, but let's not really, promise that. It's we can say it's as simple as blood donation. We cannot say better than that. But anyway, so definitely, as Sashi said, 90% of the times it is peripheral stem cell donation. Rarely we have to do bone marrow things. So, and also one very, very important point we have to stress is they will be called only if they are a match.
Yeah.
And the chance of that is very small.
Yeah.
Okay. And if they do match, then that, they are the lifesavers. They become heroes. So yeah.
I think somebody's asked how do we volunteer to motivate Indians? May I know the path, ma'am? That is Dr. Shashi question.
So please get in touch with me, and I will let you know. I will guide you how to do it. Probably I'll put my email address there in the chat box for you to get in touch with me.
So I think we are done, and we have got a lot of clarity about how we are going to do this. And now it's time that we convert this into action. We call for action, and we'll be starting a social media campaigns, doing a panel discussions. And I request all of you to fill the form, and our teams will be reaching out to you and how we are planning and what are the tentative dates. And those dates will be forwarded to Datri so that we can, materialize the on-field activities and the camps at respective colleges, and also be rest assured that it's not just medical colleges. You can also find, if you have connections in different communities who are interested to do these drives at community level, be it a temple, be it a church, be it a mosque, anywhere you feel like, okay, there is possibility that we can do such drives. So there is these things, they don't have any borders, they don't have any religion. It's something that that we need to think as humans. So if you find, or if you can arrange 200 300 people, and they're willing to do that, you find a right place, we can do arrange a drive at that particular place. So there is no right place or right time for it. Okay, so reach out to your colleges, and we'll be helping you out. And also James will be giving out you a template of letter from our national team, so that it's easy for you to reach out to your administration to get the permission. We'll do that difficult part for you. It's just that you have to get that intent to do these drives at in your colleges and your respective communities. Okay, so with that thought of, we'll end this meeting. And okay, yeah, I think we have Dr. Idara as well. Okay, just a minute.
Dr. Idara, you can unmute yourself.
Just unmute. Yeah, sir, now you can unmute, Dr. Idara.
Hi, congratulations, Abhishek, and especially for the doc from Datri. So there is a meeting happening in my medical school called exhibition. Maybe they can able to collect the sample from that medical school while there is exhibition for the whole town is coming. So awareness. I'm sure the colleges also have this kind of things. So research day and other days. So you may want to where they collect together, or maybe anniversary day, freshers day, etc. In a booth like what you did in GHS. That's why I just want my 2 cents. And thank you for doing this. Appreciate it.
I'll get in touch with the Guntur Medical College folks and then do that.
Okay, thanks.
So thank you everyone for joining, and we hope this will be converting this into action and create an impact. And as Dr. Amit told, that we are going to write history for sure. And with that, I'm thankful to Datri and API leadership for supporting us and believing in us that we'll be able to do this. And we'll always be requiring your support and guidance in every step. Thank you. Have a good day.
Thank
Take
you,
care.
everyone.
Can you take a picture, group picture, Abhishek?
Yeah, that's a good idea. So everyone, I think let's have your faces. Please turn on your cameras. this time it's different. Usually it's me who's, asking for pictures to Dr. Sashi, and it's Dr. Sashi is converting into a social media influencer now. Nice.
I
By the
got
way,
inspiration
guys,
from you.
by the way, guys, we have a dedicated stem cell page by API. I'll share the Instagram link in the group so that you can follow that group, follow that page, and with efforts of Dr. Sashi has been, converting all these campaigns into advocacy. So hopefully your drives that you are gonna do, it will be, posted on all the James channels as well as on the RP stem cell Instagram page.
I need to get into the habit of saying James, not games.
Yeah.
So smile everyone. Cool. Just funny.
Other thing is, I want to tell in PG board there is going to be a seminar. I'll share with you, Abhishek. I think Dr. Ramesh sir is addressing the IMR International. So we'll look into that one. I'll share the link to so.
Did you take the group picture?
Yes, sir. Just taking.
Hang on. All right, there you go.
Just one more. Yeah, got it.
All right.
Yeah. So thank you everyone for joining, and let's do this. Take care, guys. Have a good day.
Bye-bye. Thank you. Have a nice
Bye bye.
weekend.
Okay, go ahead and watch India USA cricket match.